We started our nursing program the first semester, and that's when the pandemic really started, so it was really hard adjusting.
Some students are visual learners, some students are tactile learners, some students are multimodal, and moving from being in person and then being completely virtual was really a challenge for everybody.
When nobody else was on campus, we were here. So we provided clinical support for the students from a distance, doing virtual simulations, and then at the earliest opportunities, students were brought back to the university so that they could provide hands-on care utilizing something called a high-fidelity simulation mannequin. Basically, this is a mannequin that mimics real life as much as is humanly possible with the technology today. So they can have a real-time conversation with a patient. They can see a patient suffer from hypo or hyperglycemia, hypo or hypertension, who requires a blood transfusion, who has a seizure, any number of conditions, and then they have to clinically reason as a nurse would standing at the bedside. What is my priority activity now? What do I do first? What do I do next based on the change in the client's status? And in that way, we were able to continually challenge them to practice nursing at their appropriate level.
As a little child, I always wanted to do nursing, and so the pandemic actually made me realize that, hey, I have strength in me, like I have support system. So I can actually make it because I've always been told that when things get difficult, then there's a blessing on the way. So like just that mindset actually helped me like focus on my nursing program.
I would say that it was challenging in a way since COVID hit a lot of people in many different ways, but overall I felt like it helped me bring out a side of me that I never knew, a resilience that I would have never thought that I could have overcame if it wasn't for those around me or the pandemic that occurred.
Me becoming a nurse has been 17 years in the making. And so being able to live through a pandemic and learn how to have nursing skills through that made me want to become a nurse even more.